I'm a father of 4 children and a husband to their mother who suffers from severe persistent asthma. I'm also a primary care pediatrician at the Mayo Clinic and president of the Minnesota chapter of the American Academy of Pediatrics. Today I speak on behalf of my family, my patients at the Mayo Clinic, and the 1,000 pediatricians who belong to the Minnesota chapter of the American Academy of Pediatrics. I speak in favor of the proposed rule change. I am submitting exhibits R through X, studies published over the last 10 years or so in a variety of peer-reviewed medical journals supporting the authority and the procedures by which we are discussing this proposed rule change, and specifically speaking to the role of exemptions, the role of a requirement for school and daycare, and the success in terms of its effectiveness in improving vaccine rates across the countries. These exhibits R through X have been submitted.
R through X are Go ahead, Dr. Jacobson.
My support for this is a personal one, and I'm going to speak to the choices that have been made that are needed and reasonable. And so I'll speak from my own personal experience. I mentioned my children and wife first. We are all fully vaccinated. In fact, my oldest boys participated in the earliest vaccine studies of the Haemophilus influenza type B vaccines in the 1980s. And because of my wife's asthma, all of my family has been getting annual flu vaccines for decades in an effort to protect her, long before the vaccine was universally recommended. In getting those vaccines, we created a cocoon around her, one more layer of defense to protect her from flu-related complications of her asthma. Yes, she received the vaccine, but not everyone responds every time to every vaccine. Over the years, I'm sure she needed that cocoon. By making sure that she had those vaccines, and that we did too, she was doubly protected from the serious flu-related complications of asthma. That sort of protection is what we pediatricians and child health advocates are seeking from the school and daycare immunization rules. Call them cocoons, halos, invisible shields. They are that double protection that our patients need. We are seeking not only the individual protection for each and every child in Minnesota, but a second layer of protection of vaccination of those around the children who can least afford such illnesses. In today's society, most children congregate in daycares and schools. These very public settings are, for the most part, very good and very safe for our children, but they do permit children to expose other children to infectious diseases. We are fortunate to have outstanding, safe, and effective vaccines that prevent many of these infectious diseases. And as a matter of course, we should expect to vaccinate our children against them. In fact, the vaccines that the Minnesota Department of Health wants to add to the rule are all recommended by the Centers for Disease Control and Prevention and other major medical associations, including the American Academy of Pediatrics. The vaccines to be added today are recommended with the same force as the vaccines recommended a generation ago. The proposed rule basically brings Minnesota up to date. Again, these organizations support these school and daycare immunization rules because cocooning is necessary. Not all children in daycare settings are old enough for the vaccines needed to prevent these diseases. Not all children attending daycares and schools will get the vaccines, will actually respond to them. They depend on others around them every day to be protected against these diseases. Otherwise, their peers might bring the diseases into the classroom or daycare setting and inadvertently expose them. Most of these vaccine-preventable diseases are not apparent at the time when a child contracts them and exposes others. Just because you do not see them does not mean they are not there. All of these vaccine-preventable diseases are still out there, often just a plane ride away. Again, my own story will help illustrate the importance of cocooning. Decades ago, as a medical student, I remember infants under my care at the University of Chicago hospitalized with measles. These infants were very sick, dependent on intravenous fluids and oxygen. There were no, and still are no, antibiotics for these babies. They're too young to get the vaccine. They got the disease from older children whose parents failed to vaccinate them. Some of these babies died. We have had safe and effective measles vaccines since 1963, and we still have sporadic outbreaks in Minnesota and other parts of the U.S. Babies still die from measles. These babies would still be alive if we had been able to protect them through vaccination of those who are in contact with them in daycares. Those who came in contact with them in daycares would have been protected if their older siblings had been protected from by school immunization rules. Failure to vaccinate puts not only the individual children at risk, but whole communities at risk. As a resident at Yale New Haven Hospital, I remember the terrible ravages of Haemophilus influenza type B. We had a great deal of respect
Doctor,
for...
can you
yes.
do Haemophilus influenza for the benefit of our record?
Haemophilus, new word, influenzae, and then type B.
Thank you kindly, Doctor.
This disease was so horrible, we always use the long name when we talk about it. Parents and doctors now call it HIV for short. Here was a disease for which we back then had no licensed vaccine. Infants would come to the hospital in the middle of the night with high fevers, inconsolable, and not completely with it. Their skin was blotchy and discolored, and they could not feed. Our evaluations included spinal taps that would confirm they were suffering from a contagious form of bacterial meningitis, a disease spread by older children who carried the bacteria innocently in the lining of their noses. I remember one such baby, really a toddler, recently walking and talking, now reduced to a red-faced, inconsolable, crying terror. His mother could not comfort him. He did not seem to hear her voice, and her touch seemed to burn his skin. The nurses struggled to hold the child for the spinal tap. We inserted the needle in the space between the vertebrae and the lower back, and instead of clear spinal fluid, thick yellow pus dripped out. The baby had severe bacterial meningitis, a devastating infection of the lining of the brain. The child never spoke again, never heard his mother's voice again. I remember a year or two later seeing therapists work with him with braces in an attempt to teach him to walk. In my years of training, I saw such cases of bacterial meningitis every week, and in those years, my wife and I gladly volunteered our 2 baby boys for the first human studies of the vaccine against Haemophilus influenza type B. We were fortunate enough to be able to get that vaccine as part of a research study. Today in my practice in Rochester, Minnesota, I work hard to make sure my patients get vaccinated on time to prevent this horrific illness. We depend on the vaccine because the disease spreads silently from child to child. Most children infected do not develop meningitis or blood poisoning, but they're contagious to others without even knowing it. They just pass it on to the next child. We do not know who will spread it and who will develop dire consequences from it. Vaccines are our only defense. The meningococcal disease, whose vaccine is recommended in this update, is very similar to Haemophilus influenza type B. However, instead of attacking infants, it attacks adolescents. Again, most who acquire this Neisseria meningococcal infection do not know it or suffer from it. They carry it in their nose and expose others inadvertently. However, a few of those exposed go on to develop either meningitis or blood poisoning. The disease moves so quickly and in hours can kill or maim that adolescent. This is even despite getting to emergency room and starting antibiotics. Survivors often have permanent brain damage, hearing loss, gangrenous body parts have to be removed, and our antibiotics fail to reverse the course. Only through vaccinating our adolescents throughout our communities can we protect them from this terrible disease. Again, my support for these rules changes are personal. In my training, I found myself in a very difficult spot. My medical school could not afford to provide us medical students with hepatitis B vaccination. We were at risk from accidental needle sticks, but at the time, given the expense of the vaccine, we just couldn't get it. Frankly, hepatitis B is a more nefarious infection than you or I'd like to think. While many will relegate it to blood exposures from needle sticks or drug abuse or sexual transmission, in this country, a good 20 or 30% of hepatitis B infection goes unexplained. This is very different from HIV or hepatitis C, where we can explain 90-95% of all the cases. It appears that all of us are actually at risk for hepatitis B, and many children who acquire it in the first 20 years of their lives get it inadvertently from unknown sources that we can't identify. As a new physician at Mayo Clinic, I testified at St. Paul for the need to protect our infants with universal hepatitis B vaccination. That was back in 1989. I am proud of our state's decision back then to support universal hepatitis B vaccination, and I'm proud today to support a hepatitis B requirement for kids in daycare and early childhood programs. The science supporting that decision has not changed. Our children still need that protection. Hepatitis A, one of the vaccines included in the proposed revisions to school and daycare rules, is nowhere as sinister as hepatitis B. But it can really harm the parents of young infants and put them out of commission for weeks or months. And it can overwhelm a patient who already suffers from an ongoing liver disease. Adults getting ill with this, having caught it from babies, are left sick with nausea, vomiting, yellow jaundice, and the loss of appetite so severe that they can't work for a month or two. The disease is passed on from person to person by the fecal-oral route. I'm not going to go into the graphic details, but this is why the proposed rules include hepatitis A vaccination as a requirement for daycare attendance. It's not an issue of personal protection, it's a community concern. And I cannot, as a pediatrician, protect my patients' young parents if I can't hold the daycares accountable for making every infant attending is so vaccinated. Another disease I deal with regularly nowadays is pertussis or whooping cough. We're at the tail end of another epidemic in Rochester. It's primarily affected school-age children. It begins with a cold and a cough that leaves them with a chest-racking cough that lasts for 3 or more months. We're scared to death of infants getting this. For them, it can be life or death. I remember days before Christmas when I was a second-year resident at Yale traveling by ambulance to a submarine base one snowy day to pick up one twin baby with severe respiratory distress, followed by another that next day to pick up the baby's twin brother. Both spent a year in the hospital, in and out of the pediatric intensive care unit, suffering from the ravages of pertussis, seizures, apnea, and pneumonia. Unbelievably ill. I've cared for other babies not so lucky, babies who died from pertussis, their hearts giving out from exhaustion. We now know where pertussis comes from. Teens and adults with persistent coughs, up to 10% of them have pertussis, a vaccine-preventable disease. While the vaccine is safe and effective, it is nowhere near 100% effective, and the immunity it provides only lasts for years rather than a lifetime. We need these school rules to double up the vaccine's ability to fight off pertussis and make sure everyone has the vaccine, to maximize its ability to prevent pertussis through its universal use. The revised school and daycare immunization rule updates language about pertussis containing Tdap. Now I'm going to share a little dirty secret with you, one that convinces me of our need for daycare and school rules. The secret goes something like this. Parents of third or fourth born children often know more than their young pediatricians do. That's okay. I respect experience as a teacher in most cases. However, when parents get lax about the well-child visits, they miss the vaccines that we give at those visits. It leaves their third and fourth born children under-vaccinated. In fact, being a third or fourth born child is the #1 risk factor for under-vaccination in my county. The overwhelming proportion of parents who get notices from school or daycare that their child is behind in vaccines immediately go and get those vaccines. They are often surprised and disappointed with themselves that they hadn't got the vaccines, and then they recall that they skipped the well-child visit. Perhaps, again, recognizing from experience what they had learned may not have needed the well-child visit, but they recognize they need the vaccine. And that's what these school and daycare rules. It is not that these parents were seeking exemptions. It was instead that the vaccinations fell through the crack as life got busy. As our vaccines successfully suppress the diseases they prevent, the parents lack the reminders that their children still need the vaccines. The school and daycare rules serve as additional, timely reminders to help parents keep their children up to date. Studies across the country have repeatedly shown this. School and daycare rules work. They improve the vaccine rates. In addition, communities that support school and daycare rules suffer from less vaccine-preventable disease. There's another reason to update our school and daycare rules. Parents do take these school and daycare rules seriously, and they treat the vaccines that are required differently than the ones that are not required. That's not altogether a good thing, but it's real. And it's a particular issue with our newest residents in Minnesota, those who come from other cultures and speak other languages than English as a first language. Our newest vaccinations, like Hep A and meningococcal vaccinations, that are not included in the current school and daycare rules, get short shrift. Parents think of them as not as recommended and not as important. That's not true. They're just as recommended and just as important. By updating our school and daycare rules with the newer vaccinations, we're going to overcome this artificial obstacle for parents in understanding what the children need. Are there too many vaccines to be given at once? Can these vaccines given together overwhelm a child's immune system? Parents do ask me these questions. The answer is a loud and resounding no. Scientific studies show that our immune system even in the smallest, youngest infants, can handle many magnitudes of order more immune-stimulating proteins and sugars, or antigens, than our modern vaccines present. In fact, back in the days when babies routinely got the smallpox vaccine or the whole cell pertussis vaccine, they received far more immune-stimulating proteins and sugars or antigens in those single vaccines than we give in the whole set of vaccines today. The biggest immune challenge babies get is not in the vaccines, but in their feeding, and really the first feeding and the first day of life. And they do just fine. To put it in context, every day at daycare, a child encounters an average of 2 or 9 more new antigens in terms of infectious disease exposures. Are these vaccines safe when given together? People opposed to modern vaccination often claim these vaccines were not studied together, and so we just don't know. But that's not true. In fact, our childhood vaccines are studied together before FDA licensure at the recommended ages when these vaccines are to be given, with all the other vaccines due at that age, in tens of thousands of children. Frankly, our vaccines are better studied in more individuals before licensure than anything else we have in our medical formulary, including any antibiotic or any antiviral. No, these vaccines are not too many. No, these vaccines are not unstudied. These vaccines instead are the right number and are safe and effective, and you and I should make sure the children of the state benefit from them and do not go without the protection they afford. These rules help protect parents, protect their children, and in turn these vaccinated children protect our most vulnerable children whose bodies may not be able to fight off these diseases. We need to be clear about this. Up to 10% or more of my patients suffer from conditions that leave them at higher risk for these vaccine-preventable diseases. But those very conditions leave them less likely to respond to the vaccines themselves. They need our protection. It's our duty to protect them. Therefore, you see, these vaccines are critical in protecting not only the health of individual children, but all they come in contact with, and subsequently, all the children those children come in contact with. They're critical to our schools, daycares, and communities as a whole. For all these reasons, I, along with the Minnesota chapter of the American Academy of Pediatrics, strongly support the proposed revisions to the Minnesota school and daycare rules. Thank you for your time and attention.